Okay, my name is Danielle, and I'm going to be performing the IV fluid and medication administration today. First thing I'm going to do is knock on the patient's door, go in, perform patient privacy. Hi, my name is Danielle, and I'm going to be your nurse today. The doctor wants us to administer, or is ordered to administer 150 milliliters of normal saline and 100 milliliters of amoxicillin antibiotic. So can you please confirm, this will take about 40 minutes roughly. If you have any questions during the procedure, please let me know at any time. Can you please confirm your name and date of birth? Patient confirm name, date of birth. Do you have any allergies? No known allergies. So the first step is calculating the drops per minute. So 150 milliliters of the normal saline times 15 drops over 60 minutes equals out to 37.5, which is rounded to 38 drops per minute. So what I'm first going to do is perform hand hygiene. Okay, I'm going to get my gloves on. So the first one is the primary tubing, which is going to be administering the normal saline. On the package, it is 15 drops per minute is adequate for this tubing. I'm going to open the tubing, take it out of the package. Okay. I'm going to identify all of the different parts of the tube. So first is the spike end, which is covered with the cap because it needs to stay clean. Next is the drip chamber, which is this part right here. Down the line is the roller clamp, which adjusts the drops per minute, and the Y port, and then the adapter end. So first things first, I'm going to open the normal saline bag up. I'm going to check the IV, the peripheral IV for patency. Make sure there's no redness or swelling near the site. There's no redness or swelling near the site. On the IV or on the normal saline bag, you're gonna take off the red cap and spike the bag there. The other port is for medication to put inside of the normal saline. Okay. So I'm going to take the cap off the spike end, place it inside of the normal saline to spike the bag. Okay. And hang this bag up. So I'm going to use the prime the chamber. So I'm going to squeeze that so it fills the line, and you'll see the line or the fluid going through the line, which is a good sign. Gets out all the air bubbles. Now I'm going to count for 1 full minute to calculate the 38 drop, or to confirm the 38 drops per minute is adequate. Okay, so I'm going to confirm. Okay, so Okay, so that's 38 drops per minute of the normal saline. I'm going to hang this over the IV line or IV pole. Next, I'm going to start with the secondary line. This as well is adequate for 15 drops per minute. So, and hanging up the two lines, it has to be 30 inches above the patient's peripheral IV line. And the second bag is higher than the first bag, so I'm going to go ahead and put the clamp on for less tangling moments. Okay. So this is the secondary line. Going to now, this is for the antibiotic at 100 milliliters times 15 drops for over 15 minutes is 100 drops per minute per the MD orders. I'm going to open up the bag and confirm the 6 rights. But first I'm going to look at the antibiotics and make sure that their expiration date is good. There's no cloudiness, no abnormal findings to the medication. Now I'm going to confirm the 6 rights: right patient, right medication, right route, right dose, right time, and right documentation. Again, I'm going to ask the patient, do you have any allergies? Just in case they didn't hear me the first time. Patient says no. So now I'm going to spike this one. Same thing, take off the red port, take off the plastic cap. This needs to be kept clean. Spike the bag. Okay. And then this, again, the second tubing gets hung higher than the primary tubing. I'm now going to, prime that. Count for a minute to confirm 100 drops per minute on the IV solution. So I'm going to make sure, use the roller clamp to adjust the drops per minute. Count for 1 minute. Okay, and that is 1 full minute. So I'm going to drape this one over. Get an alcohol swab. Okay. I'm going to wipe the, get the primary tubing off of my IV line. Sorry, I'll tangle it up here. Okay. Get the primary tubing. I'm going to cleanse it at the Y port with my alcohol swab. Wipe my glove, and when my glove dries, that is adequate time for the Y port to dry. Okay, should be adequate time. So I'm going to connect the antibiotics to the Y port. On the secondary tubing, there's a plastic cover covering this. I'm going to connect it to the Y port, like this. So then all of the secondary tubing and the primary tubing are all connected through the Y port so they can go into the patient's peripheral line. Okay. Again, I'm going to check for patency, IV patency, any redness, swelling. Ask the patient if you have any questions, any concerns about the procedure. I'm going to take off my gloves, put them in the trash, perform hand hygiene. I'm going to put the bed in the lowest position, call light within reach, and a tray table within reach.